we appreciate that and are trying to infuse gender into our programming, trying to bring out male champions. Can they, advocate to other male, the male participants in the community to join the bandwagon of care reform and the protection of children? But I know it's an area that we need to delve deeper in terms of control. We know about cases of cash transfer in previous programming where you will send money to the man of the house because you're using a mobile phone, and the money is intended to support the woman in the house for business, but that money will not reach the mama in the house. Reason being, the control is with the man. But if you go into like agricultural activities, we engage, we try to bring men. They sort of get interest in terms of agriculture. Yeah, if I have not answered conclusively, we can meet later. Then Tabitha, I am sure you know that the men associations in church are very strong. It's not an area that we have, I would say we have really engaged so that men can bring boys into the programming. I'm sure it's an area that we need to, work deeper into. But I just want to say that we are using various mechanisms to ensure that men participate in our programming. Thank you. I think that was it.
Thank you so much, Madam Nina Margaret. This is a sub-theme which attracted a lot of presenters, and it is so key to us because it talks to the interventions. The upcoming presenters, kindly manage your time well. I now call on a team. This is Teresa, Kaboche, and Thoya. If you are here, just come in front. All of you, then you organize how, or if. Let's welcome her. She's going to take us through systems approach in addressing child protection issues, a case of USAID Nuru Toto.
Good morning. Yeah, thank you so much. My name's Teresa Ouma. I work for PATH Kenya under a project named USAID Nuru ya Mtoto. Welcome, and hoping for a more interactive session with you today. So USAID Nuru ya Mtoto is a project that is funded by USAID. So USAID Nuru ya Mtoto is a 5-year project that is funded by USAID, and it's led by PATH Kenya, and it is being implemented in partnership with the county government, also local implementing partners. It's implemented in various counties within Nyanza and Western, and this is a project, a service delivery project that provides comprehensive HIV services. It also supports orphaned and vulnerable children, also supports adolescent girls and young women. And our goal is to address HIV and AIDS through high quality care and treatment services, and also safeguard the rights and welfare of children and adolescents who are impacted by HIV and AIDS. So our lead approach as USAID Nuru ya Mtoto is we partner with county government and local implementing partners in the 7 counties as earlier said, and we deliver high quality gender sensitive integrated and evidence-based HIV services supporting the journey to self-reliance. We believe that the services we provide as a project fosters the journey, achievement of the journey to self-reliance, ensuring that families remain strengthened, empowered and resilient to be able to take care of their needs. Not just the families, but also the counties that we work with. We also work with and through national and county leadership structures through a process of co-creation, whereby each and everything that we implement is co-created in collaboration with the government departments, mostly the Department of Children's Services, the Department of Gender, the Department of Health, working together to ensure that whatever we are implementing is based on their intended plans for the county for specific annual plans. And these plans are co-created, implemented, and co-monitored together with these government departments. So we also leverage public and private stakeholder contributions. We don't work alone. We believe in collaboration, and therefore the public and private stakeholders contribute equally to the work that we do. We also ensure service interventions and target to populations and geographies with the greatest needs. So we don't just take our services where they are not needed. We assess and take specific services to the people who highly require them. We have 4 strategic objectives, and the first strategic objective in our program is to increase availability and use of combination prevention services for high priority and key populations. The priority area 2 is to increase access and demand for high quality HIV treatment. 3 is to increase access to high quality health and social services for orphaned and vulnerable children and their families. And the last one is to strengthen the capacity of county health system, local implementing partner, and communities to deliver high quality health services. And it is under the last priority or strategic objective that I'll measure this presentation. So of course I talked of the areas of our areas of focus, which is HIV care and treatment services. And under HIV care and treatment services, as we all know, it's all about providing or supporting the county government to provide HIV testing and prevention services, including treatment, access to care, screening for cervical cancer, TB screening and treatment, and health system strengthening. Then under adolescent girls and young women, we implement DREAMS. DREAMS is an acronym. Here we aim at reducing new HIV infections amongst adolescent girls and young women. If you look at our area of operation, you realize that we fall under LREB counties, where we have the triple threat is really affecting us in terms of adolescent pregnancies, new HIV infections. So our focus is also to ensure that DREAMS is used as a tool to reduce, to lower the triple threat. We also support orphaned and vulnerable children, and the interventions provided for the children, orphaned and vulnerable children, and aims at safeguarding the health, rights, and welfare of those children and adolescents. So where do we work? We work in Kakamega, Vihiga, Kisumu, Homa Bay, Migori, Kisii, and Nyamira. We implement different projects in different counties. These are our partners. I may not be able to go through the entire list, but these are the local implementing partners that PATH works with. So as a project, we've aimed at working in close collaboration with the county government, and we've identified some child protection system issues that we have worked towards addressing to ensure that our children are safe and their well-being is safeguarded. So one of the identification was that there's inadequate planning and coordination. This included child protection issues which are being dealt with by different actors within the county, but you realize that all these actors, in as much as the keyword is child protection, the main person, the person in the picture is not the child. So yes, we have resources allocated for child protection issues, but how much of it or how much focus is purely geared towards the child? So that was a gap. There's inadequate implementation of existing laws and legislations. Looking at the Constitution 2010, looking at the Children Act 2022, among others, you realize that there's inadequate implementation of this within the county setup. And therefore, as a challenge, this was identified, and the project worked towards reducing this. Then negligible services relative to needs. You realize that resources for child protection are very lean. within the county. But even what we have, the lean resources that we have, are not being adequately utilized to reach and meet the needs of the intended population, who are the children, especially the orphaned and vulnerable children. We also identified inadequate data and documentation on child protection specific issues. So our approach to address the issues, first, is fostering cooperation, coordination, collaboration mechanisms among both public and private players. So as I said earlier, we are not working alone. So we worked with the county government, the key players as the key player, and also worked in collaboration with the CSOs within the county to ensure that we have a well-coordinated system within the county to be able to address the existing issues pertaining to child protection. Then, of course, we also went ahead and built capacities of child protection structures and service providers. And here, we also work with the lowest level of child protection structures, the community, the CPVs, the child protection volunteers. We also increase investments in children through fast-tracking development of county-level child protection policy. As a project, we believe that a child protection policy is a key tool that can be used to persuade the government and other actors to be able to support children and also include the needs of children in the budget cycle. So we also work towards ensuring that the counties we work in are supported adequately to be able to develop these policies, which are key instruments for use in soliciting support to children from different actors within the county and as well as the government itself. So this is our roadmap to addressing child protection issues. So what we did, we held sensitization meetings with county stakeholders. These sensitization meetings were geared towards ensuring that each and every stakeholder understands the need of a child within the counties of implementation, understands the gaps that were identified in the previous slide, and are able to work towards supporting each other to address those specific challenges affecting children. Then we mapped OVC stakeholders and services available in all the implementing counties, that is Homa Bay, Kisii, Migori, Nyamira, and Vihiga, where we implement OVC program. Then we supported the counties to establish county project steering committees to provide leadership on child protection. This committee is very instrumental in ensuring that child protection specific issues have a clear coordination mechanism within the county. And they are not just, child protection issues are not just left to the Department of Children's Services alone, yet we have CSOs within the county who are mandated to also work on child protection specific issues. So we also used case management and we used the child protection information management system data to identify some of the gaps in child protection, and the steering committee developed an investment case on this. So again, working with the coordination, the steering committee in partnership with the Children Advisory Council, we have drafted child protection policy for Homa Bay, Kisii, Migori, Vihiga, and the policy will provide framework for financing child protection services. So these child protection policies are at different stages, with some of them being revised to be able to incorporate the Children's Act 2022 because there are aspects that were missed out in the initial drafts. Some of them are under public participation, and we believe that soon enough, the counties where we implement will be having this key tool that will support in financing child protection services. So what are our results? Based on the planned activities that we had, in Homa Bay, Migori, Kisii, Nyamira, and Vihiga, you realize that we've been able to, the county children advisory councils have been able to map all the service providers And these service providers have been documented in a service directory, whereby now you are able to walk into an office and be able to know who is doing what in which specific county through the support of this project. We have also incorporated and participated in sector working groups like social, health, education, and agriculture. And we've also been able to achieve annual allocation of resources for vulnerable children in annual work plans. Realizing that we have different CSOs within the county who are also mandated to work towards ensuring that children have a better future. We also use the coordinating mechanism that I talked about to persuade these partners to be able to involve matters children in their work plans. And therefore, we realize that if we are working towards paying school fees for children within a county, we have children, more children being reached as different organizations have budgeted for this, and we are able to bring together pool resources and ensure that a good number of vulnerable children are targeted with these resources. Again, through the coordination mechanism, they've been able to participate in the county work planning and budgeting committees. Remember, it is through this coordination arm at the county level that they are able to participate in all these work planning and budgeting committees for different departments to ensure that child-specific issues are incorporated. And through this, we've seen a milestone of our children receiving services beyond what the project can provide. Again, we've ensured county plans and budgets reflect vulnerable children needs, and this is awaiting policy enactment. So I believe that upon receipt of this or finalization of these policies, we will see a more comprehensive coverage of children needs within the counties of implementation. So alongside that, we've been able to recruit and train 468 child protection volunteers, among whom 268 are engaged in our day-to-day work as community health promoters. We also have Children Advisory Council at all levels sensitized on 2022 Children's Act. This is at sub-county level, ward level, and county level through our support. We've also been able to identify county TOTs, 45 of them, and also train them on sexual and gender-based violence to ensure that we work towards elimination of the triple threat. We also have supported all the CAC meetings as scheduled and disseminated the violence against children and NRRP reports to all the sub-county and county level teams. So alongside this, we've also held engagements with Kisii, Homa Bay, and Migori County MCAs and executives on child-friendly policies and resources allocation for OVCs. We all know that engaging government stakeholders, sometimes engaging government officials is never easy, but through the steering committees that have been identified and developed in each and every county, you realize that reaching these specific government officials has become easier, and we are able to engage and discuss on how resources available can be utilized effectively on children. We've also been able to finalize case plan and launch it in September for Nyamira, and Migori, as I said earlier, is undergoing alignment with Children Act. So all county steering committees are currently engaging the assemblies on policy and financing for OVC through sector working groups, and we believe this will yield a good result. Again, sustainability teams engage private sector, business, community, and religious forums for support in influencing the county government on policy resource considerations for children. Finally, we've also engaged HES, private sector and stakeholder, and secured commitment for support of OVC, Postbank, Equity, KCB, Ajira Digital, whereby we are also, through them, we are also supporting our caregivers to be able to enroll in microfinance institutions, be able to access small loans, and be able to meet the needs of their families. So in conclusion, we've learned that systems approach address child protection more holistically and brings greater focus on prevention and strengthens the critical roles and assets of the key actors responsible for child protection. This happens through building capacity of actors at all levels to perform their child protection responsibilities and also strengthening collaboration between formal and informal sectors, addressing root cause of violence against children and especially poverty. So thank you so much.
Can we appreciate her? Kindly let us react, and we'll take a maximum of 3 reactions. For the sake of time, also be concise in your reactions. Can we start from this side?
Thank you very much. I'm Samuel Kimani, a sign language instructor and also a parent of a child with disability. I'm just concerned, or rather I have a question for you on when you are doing what we call capacity building of actors at all levels. How do you involve deaf people? Do you have sign language interpreters on board? And how do you work with the county government to ensure that children, our girls with hearing impairment, are well heard and catered for? My concern also goes to all other CSOs who have presented themselves in this conference. Well, I have not heard of any that is targeting persons living with disabilities specifically, because these are people who are special and they undergo very, very critical issues that normally go unsolved.
Thank you. With the disability, vulnerability increases. Just, madam, there is somebody once. You have declined again. I thought you raised your hands. Any other person in the middle row? The last row? It appears we only have one reaction. Kindly respond.
So thank you for your question on our involvement on children living with disability. As an OVC and DREAMS implementing partner, among the children that we support, we have children living with disability, so allow me to start with that. And our goal for all children is to ensure they are safe, schooled, healthy, and also stable. So whenever we come across a case of child living with disability, we first ensure that an assessment is conducted in collaboration with the MOH to establish the nature of disability, whether they are qualified to be in school, and we engage them by ensuring that they receive the services that they require. We also push towards ensuring that they are registered with National Council of People Living with Disability, because through this they are able to access other government-specific resources allocated to them. So we do that. For capacity building, involvement of maybe people living with people with special needs, we also work directly, as I said earlier, with the departments, and social protection department within the county has a number of staff that are well trained on being able to interpret. So in an event that we have a meeting where we have people with special needs, we also have an interpreter who is able, a sign language interpreter, who is able to sit on board and be able to do the same. Thank you.
Let us appreciate her as she goes out to the podium. And it's just, we are restricting the reactions because of time. In the event you have a burning issue, the presenters are still with us, kindly get in touch. Our next presenter is Evan Munga from Terede Homes, Netherlands. Is going to present to us a very interesting topic on child labor in the service industry. Ladies and gentlemen, let's welcome him to the podium. Thank you.
Good morning, everyone. Good morning. My name is Evans Munga. I work for Teredes Homes, Netherlands. I'm happy to be here, and I see familiar faces, people I work with in the sector. I see people from Pusia. I see my colleagues there. I'm going to present on a very special program that we work as Teredes Homes. That is touching on child labor. And I'm titling it Child Labor Exploitation in Kenya towards a multi-sectoral based interventions approach. This program is implemented in the national, at the national level, and also in Busia County. But before I go into the nitty-gritties of the presentation, let me just bring out the layout of my presentation so that then we can interact a little bit better. I'm going to give you the brief about DDH so that then you can have the connection between the project and what we do. And of course, I'm going to talk about the child labor project itself, the interventional strategies that we use as an organization, and of course, looking at it in the process of implementation, looking at the challenges so far. And of course, at the tail end, I will talk about the recommendations. But in between, I will talk about some of the lessons, learned in the process. And of course, what we are proud of as a program. Teredes Homes Netherlands is an international non-governmental organization committed to stop child exploitation. So child exploitation is our forte, it's our business in that sector. So we're working to stop child exploitation. And our mission is to protect children by preventing and stopping the child exploitation and empowering children to make their voices count. I've heard in this conference people talking about meaningful child participation, so it's important to look at our mission when we talk about making children's voice count. What do we mean? So we'll be looking into it in this project. And lastly, our vision is children to flourish in a world free of all forms of exploitation. So you could see that as Teredes Homes, the exploitation, stopping exploitation is our core mandate, is our business. Now, towards the project itself, we're calling it Action Against Child Labor Project. Because the theme of this conference is from evidence to what? To action. So Action Against Child Labor Project, we're co-implementing it with ICS. I don't know whether ICS in the building. Good to see you, brother. So we're implementing with them in Busia County. That means we co-created that project with them. And the aim of this project is to expose and eliminate child labor in and all its forms in the service industry. If at time I could challenge you, what is your understanding of service industry and who constitutes service industry in Kenya? So we look at it from a perspective of how do we engage and how do we work with the service industry in Kenya, more particularly in Busia County, but at the national level, we're trying to build and strengthen systems, specifically with the government agencies that we work with. Now, looking at the background of this project, Teredes Homes carried out a study, a baseline assessment last year in June. June, the project started last year in June, but the assessment was done last year in August. And if you know the coordinates of that county. We're working in Matayos and Teso North. Those two sub-counties, when we did the assessment, the report gave out some shocking statistics that 45% of those children who go to school are engaged in child labor. And 55 are out of school, are engaged in child labor. So it's important to start from that understanding that indeed child labor does what? Does exist. And of course, when we look at some of the drivers, I have had discussions, people talking about poverty. So when you look at the poverty index of that county, as provided by the Kenya National Bureau of Statistics, it sits at 83%. And of course, Busia is very unique because it borders Uganda, and the factors related to porous border also comes in. But also most important and significant is that we have little understanding of what constitutes child labor. I don't know what happened. Yeah, so because of those kind of factors, we have major challenges that then act as drivers, then pushing children to be in the child labor business. And then when we go down, you realize that even the structures, I wish we had time to dissect the report, even the systems, the structures, the families, and the service industry people, the people we call in the construction industry, the transport industry, the hotel industry, they have a major contribution towards children. And like I said, Busia is one county that is unique because it borders Uganda, and we have a lot of activities across the border that then, because of other inherent factors like culture, poverty, and all those, then you find that children are involved in those kind of activities. And then we have activities like fish mongering within the town. You know, Busia also hosts Lake Victoria. We have fish coming out from Uganda, and then we have fish from Lake Victoria in Kenya. So that kind of business is booming, and you find children, because of poverty, they are the target. They are easier target as cheap labor. And it's important to have that perspective. It's not moving. In this project, we called it a multi-sectoral approach. Now we're engaging children. Children are at the center in this project. We're engaging children both in school and those who are out of school between the age of 7 and 18 years. In this project, we're working with 20 schools, 10 schools in Teso North and 10 schools in Matayos. How we engage them, I'm going to talk about the strategies, is that then they're empowered through the child rights clubs. They are engaged and working with the teachers who have been also trained. We have people we call mentors who work with the teachers to ensure that the children acquire skills. I'll talk much about it when I go to the next slide about the strategies, but most importantly, what do we need to see at the end of the project in children. Also, we engage families. We talk about parents and caregivers. Those families, in one way or the other, they have little understanding about child labor, and therefore their children are engaged in the child labor. They are rescued. When those children are rescued, they are traced back to their families. What do we do with those families and the caregivers? We take them to trainings, very comprehensive training, what we call, and ICS are here, a skillful parenting program. just to ensure, because there will be a lot of neglect issues, there will be a lot of dysfunctional family issues, there will be a lot of underlying issues within the family. So that then as we strengthen the family, it's also important that those children are also empowered in school, so that it is a whole round approach, that you empower children, but also you empower the families through those kind of engagement. I'll be talking more about them. But also the community, because a child belongs to the community. So what are we doing with the community aspect? There is there are specific activities that we do in the communities, and I'll be talking about it. We talk about private sector actors, and we're talking about service industry here. Most of the activities, most of the people who involve children are either way formal or non-formal. So they are private sector actors. So we also reach out, be it in business, which are registered, be it those non-registered engagement, like people who do brick making, as we will see. CSOs play a critical role, and I see most of them, some of them here. We have deliberately engaged most of these CSOs. Why? Because many times, most of our programming are not, we don't give all the round services. Like in this program, there is a critical component I feel that is a lesson that we've learned. We call it livelihood engagement. And most of those engagement with the CSOs, then it means that when we have that engagement with them, and we have had one with USAID for the Child, I see them here, so that then we partner with them. We see how can we share information, how can we link with them, so that most of those services that we are unable to give, they are able to pick them up. And of course, government officers, both at the national level and at the county government, so that their mandate is to provide, protect, and of course ensure that those service delivery is mainstreamed, coordinated, and are given up to the optimal. So we work with them, and of course I will share more about this. Now, this project has 3 major outcomes. Outcome number 1 focuses on children. Outcome number 2 focuses on family, communities, and societies. Outcome number 3, which is the last one, focuses on government and other critical agencies for purposes of capacity building, for purposes of advocacy, and ensuring that we influence some what we call systemic change. Outcome number 1 and 2 are implemented by ICS, and those are found in the county, specifically in the community and families. Outcome number 1, focusing on children, we want to see, and it's an outcome, that we want to see a child who is empowered with certain skills, life skills, that they are able then to access those opportunities like education and certain skills, so that they are able to live. And in that process then, what do we do to acquire that kind of an outcome? Those strategies that we use include peer-to-peer approach. I talked about the child rights clubs in school, where children are empowered, those children who have certain capacities, enabling certain capacities. They are identified by the teachers who have been trained. They work with mentors. Their lives, apart from the learnings about their rights and responsibilities, there are certain skills that are given to them by the mentors working with the teachers. And also they have their own engagement as the Child Rights Club members. There are other engagement they do as children, be it in school and out of school, like a sports tournament, where they are able then to create awareness for those children who are out of school, which is very important also, because we saw that 55% of certain children in that county are out of school. There is mentorship and life skill. I've talked about it, where we have mentors working with the teachers and to ensure that the children receive those prerequisite skills, especially on issues to do with how to prevent certain aspects, child labor being one of them. Skills training and apprenticeships, there are those specific engagement where we need people like people who are not able to go to school, either because they are their families or they themselves, they are not willing to join school. So they are linked with certain skills organizations so that then they can learn certain skills that can help them to protect themselves, prevent certain issues, but also those skills can help them in some days to come. Outcome number 2 talks about families and communities. And this is looking at ensuring that the family and the community have the capacity to provide for the needs of the children and care for those children. Because families and communities have a responsibility to protect children against child labor, then it's important that we do certain issues of awareness. Understanding what constitutes child labor, we looked at that. There are people who don't know the difference between child work and child labor. There are certain understanding of child labor, child work, what forms of child labor, and all that, the whole understanding of child labor. So we do that kind of sensitization, awareness creation, community dialogues. From the study that we took, we also identified hotspots. So it's important to give them that this is what has come in the findings. This is, as a community, as a family, this is what you need to look out. Skillful parenting is a specific program that is given to those parents and caregivers so that they are able to earn certain skills, how to communicate, how to identify themselves when they are handling issues of children, how to handle issues at home, so that then it builds an environment that is favorable for those children at home. Because some children also run from home, not because they are poor, because the families have certain conflict issues, dysfunctional families. Economic empowerment, those families who have given out their children for cheap work, those children are rescued. The program as a way of giving some seed capital upon training, entrepreneurial training, so that then as the children are given education program, like scholastic materials, paying some school fees, also we strengthen the family aspect of giving them some empowerment economically to address issues, be it of poverty. And lastly, strengthening the implementation of child labor laws, policies in the service industry. What we do with this we are focusing on policymakers. We're focusing on government agencies, be it at the county, be it at the national levels. Currently, we are finalizing on the policy audits, looking at what are some of the policies addressing issues of child labor in Kenya. What are the gaps? What are the challenges? So that then we can have a policy environment that supports the needs of and the gaps on issues of child labor. And most of our programming as TDH are research-based, evidence-based programming, and we do generate those evidence, we share, we disseminate, so that then together we can see how best then we can address these issues. Capacity building of port government agencies, call it the child labor department, law enforcement agencies, or the government agencies. Like in the county, we have at least trained 3/4 of the government agencies, and not only in Kenya, but across the border. As we train, we also, because we appreciate the dynamics of that county, we also involve the county people from Uganda, be it the law enforcement agencies, be it the media, because the media also plays a critical role on this, the private sector from Kenya and Uganda, the government officers from Kenya and Uganda, because it's a porous border, so that then we can address challenges that are associated with the porous border. And then, of course, once we have understood what is child labor between government and us, between the private sector, between the children, then we can influence issues of policy, we can influence issues of laws that we need to fix, and then, of course, address the issues that are underneath. So that is on the aspect of strategies. Now, going to the child labor hotspots, like I mentioned, of course, I mentioned this, I don't mind to repeat. We have hotel industry, restaurants where this constitutes part of the service industry, saloons where children are also involved, like barber shops and saloon and massage parlors, the transport sector, border constitutes a huge number where children, there's one school that we saw when we had the dialogue meetings with even the government agencies, the private sector people. Children just come to register and then come to do an exam. Most of this at the time, they are engaged either in sand harvesting, border business, and other things. Building and construction sectors as cheap labor, brick making, project workers, and all that. Domestic work, of course, that is also one of the areas, and the employment bureaus and recruitment agencies are also involved in this. These are some of the areas that we need to look at. And of course, because it's interior part of the sub-county, you have some illicit brews in that area. I see my time is up. I wish you can go to the next slide as I finalize. What are some of the challenges? As I was presenting, you could see some of the gaps that we looked at. There is what we call limited knowledge on child labor. Of course, I talked about people don't understand what constitutes child work and child labor. There is what we call weak implementation of laws and policies. This is a huge challenge, and that's why we are calling out the policy audits on this aspect. When we look at the laws, especially the laws that are specifically addressing the child labor, there are a lot of gaps. Most of the people who are in this sector, they are not aware most of the existence of certain laws. The implementation and application of those laws at times is not adequate. The service industry key players don't have some of the related policies, especially the private sector actors. Most of them, they don't have safeguarding policies, they don't have code of conduct. Then you find that even them engaging children, it becomes easy because they don't have much information about child labor. And of course, cross-border challenges and of course, poor policing. Undocumented loot issues associated with border also play a critical role in addressing child labor in that particular county. What are the recommendations? One, based on those challenges, is to operationalize the child labor committees. It's important to know that in this project, we actually operationalized the county child labor committee in Busia. In this country, there are very few counties, you can name them like 2 or 3, that have operationalized child labor committees. A critical structure that looks at some of the child labor issues, coordinates the child labor issues, looks at the gaps, looks at the support services at the county. It's important to have those. And those labor committees at the county, they are linked with what we call the technical working group at the national level and the National Steering Committee at the national level. So if we can address that, then we can also address most of issues affecting children. Sensitization around ILO Convention 138, which looks at the minimum age, and of course Convention 182, which looks at abolishing issues of worst forms of child labor. Kenya has ratified those conventions, but it's also important to do sensitization around those conventions. Thank you. I see my time is up, but then we can link on the site to talk more about this project.
Thank you. Can we, please, you have to take a reaction, 1 or 2. Can we appreciate him better? Thank you. For the upcoming presenter, our technical team kindly beam the time 5 minutes too, so that they are guided. Yes.
My hand was so fast up before you opened the floor, sorry.
It's okay, it's okay.
But it's because the presentation was very exciting and very informative. I appreciate the fact that you have narrowed in on child labor, but I'm looking at the fact that when you look at child labor, then you have things like sexual abuse coming in, physical abuse coming in, you have neglect, you have emotional abuse, but it's not quite coming out how this would be included in an all-rounded approach to offering protection and also strengthening the pathway. So I was wondering if maybe you could just highlight if there's anything you're doing on the side to look at such.
Next.
Thank you very
Kindly
much.
move faster. We
Hello?
don't have the laxity of time.
Thank you very much. My name is Paul. Thank you for the presentation. I'm from CRS. I would like to ask a question in regards to your presentation. As much as you talk about child labor, I would like to know or to get some insights how children with disabilities have been involved in the child labor, and if yes or no, what are the interventions which you've made to ensure that children with disabilities are also engaged in terms of your own programming so that they can be part of what you are introducing to other children without disabilities? Thank you.
Thank you so much. The last one, I would prefer if we were to have it this side now. Okay, go ahead.
Hello, my name is Priscilla Wahome. Thank you very much for the presentation. I'm a child protection consultant. As I was following the presentation, I realized that you mentioned some of the areas or the hotspots for child labor is the hotel industry, boda, and all that. Maybe my question would be, what is there any programming that is looking at addressing those hotspots as a place to begin towards eradicating child labor? Thank you.
Thank you. I must appreciate that I had a lot actually to talk. It's only that we didn't have time. The question around the heuristic approach, not only focusing on child labor, but on sexual abuse and other, abuses. How do we approach this as a program? Let me start with children. When we talk about the child rights clubs, it's not only focused on child labor. It's focused on child rights. Child labor being one of them. Sexual exploitation being one of them. And the trainings and the empowerment focuses on how can they detect, how can they report, how can they prevent, and the understanding on what constitutes child rights and their responsibilities, right? Coming to engaging with other actors, the CSOs, the government officers, and other people. First, we approach it from looking at it. Child labor is not a standalone. It's an exploitation happening amongst other violations. Child trafficking being one of them, sexual exploitation and all that. So the teachings or the capacity buildings, the sensitization and awareness is wholesome. And of course, the linkages, should this happen, how do we work with all these actors and their roles? How can we partner, and how do we ensure that, like CSOs, how do we mainstream in our programming? The DCS, the police, what is their mandate in all this? And therefore, like we have had quite exciting information coming from children, including reporting sexual-related cases. So that means it's working, if I may answer the questions. And most of the intervention that we're looking at, not only empowering them, but also looking at how do we look at the coordination of these services. Most of our trainings are actually done by most government officers, so that then we strengthen the structures that exist, unlike reinventing the wheel. Going to the question of involving the people living with disabilities. In meetings, that's one of the critical. As DTH, there are certain principles we don't overlook. Child participation, people living with disabilities, meaningful participation, and things like that. We involve the relevant department. And actually, they do mobilization, including from children. In our child rights clubs, we have children who are living with disabilities, so that then we make it all inclusive. Child participation, inclusion in all the issues affecting children, in the interventions, we also involve this. So the relevant department, we also involve them. Our mobilization also looks at that. Our intervention also looks at that. There's a question you asked about the private sector. We identified the private sectors. What are some of the solutions? In this program, if I had time, I could enumerate. We intend to do what we call creating policies, developing policies with them, not as developing, but developing with them. As the awareness kicks in, it's also important that they address the issues with their counterparts in the service industry, so that then they create the much required partnership between us and them in having the basic policies in place to address most of these challenges that exist in their service industries. In this program, we have had some of the success stories, and we are proud of it. Things like having specific cases reported by the children, the key stakeholders, and as we speak, we have active cases in court. And when we have people like the Directorate of Public Prosecution giving out those statistics, we feel happy that we had challenges of having just different cases reported as issues affecting children, but when you have particular cases reported as child labor, sexual exploitation, and all that, we feel that then the interventions are working. We have had children actually making interventions themselves. They participated in the Busia County Integrated Development Plans, and they gave their voice. We only don't talk about giving children a voice, but meaningful child participation. So I want to stop there, and thanks for your questions, and thanks for your interactions.
Thank you so much, Evans. And I think there are more reactions for this. Please get in touch with Evans after this. Because of time, the two presenters remaining, I would kindly request that we allow you to present, then make the reactions together, if it is agreeable. Because we also don't want to interfere with the lunch hour, then it will also affect the closing ceremony. So with that, I would wish to call on the floor, Madam Mwajuma. Just come, you sit, then Madam Florence takes us through her topic, which talks on interventions for child survivors within the justice system.
Good afternoon, everybody. So, my name is Dr. Florence Mweni. I'm a clinical psychologist, and I'm also a probation officer working with the Probation and Aftercare Service. My presentation is a study I carried out, part of my doctoral study, which was on the mental health needs of justice-involved children, but I'm presenting on the assessment and treatment programs for addressing the mental health needs of justice-involved children who are survivors of violence, with the background that most children who come into the justice system have pre-existing adversities that they may have gone through. And then, of course, contact with the justice system itself is a potential place where children tend to pick up other mental health problems because of the structure of our justice system. So, of course, I think that I've already finished with that slide. So, of course, we have very many reforms that have come even before the Children's Act 2022. Efforts have been made to make the justice system be very friendly to children. But then again, because of the adversarial nature of it, and the justice system is basically run by mainstream government agencies, and change takes a long time. If you work in mainstream government like myself, change takes a lot of time to be implemented. So, and then of course, change that involves specific assessments and treatments of children who come in with those mental health needs. And they are varied. Children come in with trauma, PTSD, they come with anxiety, they come with developmental disorders like learning disorders and all that. They come with ADHD, conduct disorders. They come with behavioral, basically, behavioral and emotional regulation behaviors. That is why they get arrested. And some of the underlying reasons have been mentioned by my previous presenters. So assessment is very critical because when a child has been found maybe to have been committed an offense or to be in need of some specific care and protection, does not just mean the provision of all these other basic needs like food and all that. Those of us who know about Maslow, who talked about the basic needs, up there is the self-actualization, and that cannot happen when somebody is still struggling with mental health issues. So assessment and screening is where justice agencies are expected to at least take the child through some kind of interviewing, and if possible, standardized screening, like a form of triage, to be able to understand what are you bringing, what do you have with you, how can we help you? And then, of course, more formalized form of assessment so that a treatment plan is developed in respect of the child. So my study was about finding out what is there in terms of assessment, assessment of these children, and what is there in terms of their treatment. So those are the three questions. What standardized tools are used by child justice agencies to screen and assess children for their mental health needs? And what treatment programs are in place? And what are the barriers to that screening and treatment of justice-involved children? Briefly, the study was both qualitative, quantitative, and all that. 193 justice practitioners from the 6 mainstream agencies there: magistrates, judiciary, probation officers, prosecutors from public prosecution, children's services, police officers, and prison officers. And that is the specific breakdown of it. So there were 61 males and 132 females. We had 5 magistrates, 66 police officers from National Police Service, of course, working in the child protection and gender desks, probation officers, 35 of them, 16 children officers, and 64 prison officers. So police and prison officers were the majority, and then 7 prosecutors. So in terms of the assessment and the screening of children for mental health needs, what we found out was that children's department, police, probation, and prison have some form of assessment. And we'll find out later what kind of assessment that is. There is some form of screening when a child enters, gets into, or is, when they're interacting with the child. Then, of course, the courts and the prosecutors do not have a lot of that screening. And then, of course, for probation officers, some say that, yeah, we do screen them, and then the others say they don't. So there was that kind of middle split. For the specific tools that they are used, the children officers and the probation officers talked about a tool called Youth Level Service Case Management Inventory. This is a tool that looks at this risk of the child reoffending. Mostly it's used with a child in conflict with the law. It has about 10 areas of assessment. It looks at the child's schooling history, drug use, involvement with peers, you know, the family structure and all that stuff. Just trying to assess how do those areas of this how are those areas of the child. Then children officers reported that they use case management guidelines. of course, those are guidelines. They are not assessment tools. But they use that. Police and prison officers use general guidelines and standard operating procedures that define the way that they interact with children. But overall, most of the tools used by the agencies were guidelines developed internally and just data collection forms. So there was no mention of things like more standardized ways of knowing. Like, for example, if a child has undergone trauma and they have post-traumatic stress or post-traumatic stress disorder, you know, how would you know when you're using case management guidelines or a data collection form that just says, what's your name, where did you go to school, how many are you in the family? It does not ask the child for any symptoms of any of these mental issues that they are bringing to the system. So, of course, there are barriers that were reported as to why those tools are not available and not used. First of all, they're not there. Non-availability of standardized tools. As one officer there says, we have not been provided with any tool. We only see some of them when we are being trained. But then in the fields where we are interacting with the children on a day-to-day basis, they are not there. Then lack of skills to even be able to use those tools, knowing that most of these agencies employ people from different backgrounds. Yeah. Then, of course, the other barriers, limited commitment by the policymakers in those agencies to invest in assessment and screening of children for mental health needs. And then, of course, adult clients tend to take up more time, more attention than child clients, which is really something of serious concern. In terms of the programs, I've just jumped to that previous one because it's just a simple graph. In terms of the treatment programs, that is the list of what is available. Spiritual guidance, counseling, relapse prevention for drug use, life skills, family group decision making, expressive arts, cognitive behavioral therapies, positive parenting, and mentorship. So we asked the officers, how effective do you think these programs are in addressing, in treating children with mental health needs or problems? So you can see 37.3 thought that they were effective, but about 42 there. 22 are not sure. Yeah, 20% were like somewhat effective. So who provides the programs? Who helps these children who have mental health issues? So 29.5% say they are the ones that do it as part of their job. And those who say that were mostly probation, children, and prison officers who work in these statutory institutions and see children. 52.1% reported that they rely on counselors and psychologists and other service providers who are volunteers who come, every once in a while, interns who are sent there so that they can be able to acquire some practicum hours. And then some rely also on, you stakeholders who deploy maybe a social worker here and there in a statutory institution or in an office to see children. Courts, magistrates and prosecutors said that they do not provide direct treatment, and of course that might not be their mandate. So, when asked why there is limited and non-use of evidence-based programs, there are many challenges that, there is tendency to rely on more generic one-suit-fits-all kind of programs. Then, of course, the lack of recognition and acknowledgement by agencies that children in the justice system have special needs, including what a participant was saying, children with disabilities. So programs not fitted to the individualized needs of the child. Then, of course, the lack of professional counselors and, the structure themselves, the counseling rooms and the spaces to do that. If you have served or partnered with one of those agencies and gone to the offices, I think you can be able to see that the space even and the privacy to do that is really limited. So, of course, the role of some agencies and the mandates and the way in which their role is defined by the law, you know, like a law enforcement person will not say, you know, how do you feel as I arrest you? I know you're very stressed right now, so let's take a deep breath in and out, and then let's go in there to the cells. I'm saying that the role does not even allow some of these things. So that's a challenge also. Limited facilities and structures, I think I have addressed that. And then inadequate time to spend with a child, listening to their story or listening to their issues and being able to assist them. That's a challenge. An officer here says that addressing the psychological and mental health needs requires a lot of time, and we have other pending duties and are not able to give the support needed, notwithstanding that the skills are not even there. So very minimal contact. Some agencies do not have that time. Some agencies maybe do have that time. Then, of course, the language. The language is a barrier because, of course, maybe some agencies work with children who are not able to communicate in Kiswahili or English. They only know their mother tongue, and that officer is posted in that area, and they don't speak that local language. Then, of course, like the the children with hearing and speech developmental issues, and even the child-specific, child-friendly, child-specific language, things like play therapy and all that, being a challenge to use. So the skills, basically. Then, of course, the uncoordinated multi-agency working and poor coordination prevented them from utilizing fully assessment and treatment. And then, of course, like I've said, the agency procedure. So in conclusion, the study found that mental health assessment of children is not mainstreamed, neither is it standardized in the justice agencies. And these are the agencies that are the duty bearers. They have the mandate of rehabilitation and reintegration of children with the support, of course, stakeholders. But it's not mainstreamed. None of the agencies use any of the standardized screening assessment tools to identify psychological needs of children. Then, of course, there is limited, almost, very small percentage of the use of rehabilitation programs that are supported by evidence, especially in the 3 agencies that do rehabilitation, that's DCS, probation, and prisons. So also, there is an over-reliance on volunteers and students, interns on practicum and private organization to provide those mental health services, which of course means that when the purpose for which that person was providing that service is over, they go away, and then that child is left like that until another one is found. So that kind of not very organized way and not professional way. Student interns, volunteers, those are still people who are learning how to provide the service. And then, of course, they're the ones that are being relied on to provide good service to a child who has had very many adverse experiences. So most programs are basically about teaching children vocational training and providing education. They are good, but we know that without addressing the mental health needs of those children, then even the ability to be able to even comprehend and use the vocations that they have been taught might be limited. Then, of course, the limited competence of professionals in providing mental health needs. Okay, we are here. So, some recommendations, a few. Let me start with the last one of the stakeholders. I see that there are many stakeholders supporting the justice system to undertake its work. And I see that there are very many programs here that are supporting children. I was looking at this, maybe they are in there, to look at whether there is one that says addressing children's mental well-being. Maybe it's in there, but I cannot see it. I hope it is in there. I hope that there is somebody who is going in there and looking at, anxiety, looking at depression in children in the justice system. Somebody is looking at these children who sexually offend and how to help them. There's somebody looking at children with conduct problems, children who have gone through so many things. But if not, as you design your plans and proposals to donors to support programs so that you can support justice-involved children, please think about programs that look at the mental health needs of these children, even as you look at other things. That is very important, and that is very key. It's the one that even contributes to relapse. So a child gets out of the system as a welfare child, then they cross over and come to this side as a child in need of care, as a child offender, because nobody addressed their mental health needs. So I have some recommendations, of course, for our standing committee on access to justice and administration of justice for children, that there are things that have been put in place but really not implemented, so they are there. Just like, training, joint training of the agencies and the practitioners on mental health needs assessment and program. And then, of course, some of the programs need to be actually purchased because they've been developed by others. That's patented. They can be used and tailored to this situation, so that kind of assistance also. So as I end, my clarion call is that multi-agency partnership that has been talked about is very much important and needed so that we can address the child holistically.
Thank you so much, Madam Florence Mweni. A very wonderful presentation from infused academics and practice. As I had mentioned, we will give Madam Hamisi time, then after that, we'll have the reactions together. Madam Hamisi is going to present to us on issues to do with reporting those difficult to reach cases and how they come around it. Karibu, Madam.
Good afternoon. My name is Mwanajuma Hamisi from USA Tujitegeme, Mombasa, implementing DREAMS project. We all know, or for those who do not know, DREAMS program, kindly upload it. I'll be taking you through the I'm short-sighted, I cannot see. I'll be taking you through the approaches that we came to curb inadequate reporting of violence that our girls had experienced. So, DREAMS program aims at empowering adolescent girls and young women to reduce the risk of them acquiring HIV/AIDS. However, due to underreporting, you would find that the risk of them acquiring HIV increases. So for my case, in Tononoka ward, this abstract is based on Tononoka ward. During Q1, we had enrolled girls, and out of the girls that we had enrolled, 134 girls had been screened to have experienced violence, but among those girls who had experienced violence, after when we tried reaching them out to come to receive the post-violence care, they could not come to the safe space due to one reason or another. And out of those 134 girls, we only managed to get 15 girls to come to the safe space to receive the post-violence care. It took upon the project to find out what are the reasons as to why these girls who have experienced GBV, they cannot come to the safe space to get the post-violence care. So the project decided to conduct household visits to understand the reason as to why the girls are not able to come to the safe spaces. And one of the reasons that we found out why the girls could not come to the safe space, they had stigma. They had self-stigma, and also the community had stigmatized them in one way or another. So that was the biggest challenge, to reach them out. So whenever we could call them to come to receive those services, well, when they had not accepted, and they could not come out of the cocoon that they were in. So the things that helped us, to curb this challenge, the project came up with a case reporting tool, and we started awareness campaign. The awareness campaign was supported by the community stakeholders, the village elders, the chief, because conducting household visit first, Tononoka Ward is a place where a new person cannot just come in, knock the door, and start asking questions. It is a must for you to go with somebody from the locality. So we had to involve every stakeholder who could help us access those households. Then the chiefs arranged for community barazas, whereby we started our campaigns. Then later on, we engaged people who are trained to offer the services that the survivors needed. And in the process, that is where we started administering the case reporting tool, and these were the results from the case reporting tools. The first lot of girls that came were 68, and out of those 68, 52 screened positive. Out of those 52 girls, age 10 to 14, we had the same rate. Violence was experienced at similar rate in schools and at home, and in lesser cases at the community. And for girls aged 15 to 17, they could experience more violence at home compared to school, then to the community. Then 18 to 19, girls of that age could experience more violence in the community as compared to their homes or the community. And 20 to 24 experienced more violence at their homes. As a result, we were able to get 54. We noted that 54% of violence against children occurred at home, 37% in school, and 4% in the community. But when administering this case reporting tool, it was noted that in every case, if I had 10 girls who had experienced sexual violence, who had experienced violence, out of those 10 girls, you would find that 5 of those girls had experienced sexual violence, and the other 5, maybe 2 had experienced physical violence, and 3 had experienced emotional violence. So the rate of sexual violence was a bit higher compared to the rate of physical and emotional violence, and sexual violence occurred at higher rate in the community compared to schools and at home. But the rate of which sexual violence was happening in schools and at home, it was at similar rate. Physical violence was more experienced in schools, and the sad thing, it also took place on their way when the girls were moving to the school or coming back to the school. For emotional violence, most girls experience emotional violence at their home. to conclude this, the best approaches that helped us to reach these girls were we trained peers of the same age, girls of 20 to 24 years from the same community who had better understanding of the community and the dynamics of Tononoka Ward, so they could initiate this conversation about the GBV cases, and also helped in making these girls come out and come out to get the services. And also the community, the awareness campaigns that were conducted around the community also helped. And also the people who had experienced violence, they were given the services that they needed at that particular moment. We would seek from the counselors, they would seek and they will also find from the girls, what do you really need? Yes, you had experienced sexual violence, but maybe it is not a recent thing. Which service was better for them? And that was what was given. I would say this for my recommendation. We have all done so many presentations here, and we have recommended so many things. But I would say this, whenever you have a challenge, it is very good to understand your community and you understand what works best to that community. You cannot say whatever worked well in Tononoka. Tononoka is in Mombasa, but these strategies are not applicable to the whole of Mombasa because every community has its own dynamics. So my recommendation to everyone here, kindly let's look at our communities where we are implementing. We find out what will work best in those communities, then we serve the needs of those people who need to be taken care of. And also, it is very key to engage our stakeholders. The stakeholders, not necessarily, we shouldn't start from the high ranks. Let's start from the people that communicate the same language with the people that we are offering services. We cannot go bring this DCS wakati we have the CPVs at the ground. We cannot go direct to the DO, the chiefs, wakati we have the village elders, we have the watu wa nyumba kumi, those people. I think that is what I would say, and thank you. I am welcoming all those questions that you have for me.
Thank you so much. Just have a seat. Madam Hamisi, we've heard the two presenters. Kindly let's now react. Let's start from this side. How I wish we would start from this side now. Yes, thank you.
Thank you so much to the two presenters. My name is Esther from IJM. This is directed to Dr. Mweni. Now as we move, you know we've been in this area for a long time. And so if we are moving from evidence to action, where should this assessment be a court-mandated treatment? So like for every magistrate before they engage any child, they make sure that there's an assessment sitting in front of them, because there are many children who engage the criminal justice system and haven't gone through DCS, you know? Abuse has happened, they've gone to the police station, they've testified, and they've gone to court, they've testified, and they've finished, never really interacting with DCS. So how do you think it's, is it workable?
Thank you.
Thank you very much, the presenters. Mine also goes to the second last presenter, doctor. And my name is Alex. I'm from Uganda, and I work with Africhild Center. Now, we know documentation in those offices, the probation office, and the police and other offices that work with children justice space is a very big issue. I didn't hear your recommendation on that, because it's a big issue in Uganda as well. A probation officer will tell you stories of all the children in childcare institutions, but there's no file. So if we are talking about tools, by the way, are we talking about the physical tools or maybe in the system? Thank you.
Thank you.
Good afternoon.
Good afternoon.
My name is Mercy from Mercy Global Foundation. Part of my work involves mental health among children and adolescents, so my reaction goes to the first presenter. Not a question really, but a comment for all of us to really think about. And it's in relation to what a parent there said of them having a child living with a disability. As we know in Africa, and it's the case in Kenya, mental health is a very foreign and new concept, and we're still struggling with issues of stigma and discrimination among people living with, mental health issues, regardless of whether it's developmental or psychiatric psychopathology. So it's a question for all of us really in, as we form or we develop interventions that are child-focused to eliminate violence, specifically for children who live with developmental, challenges and mental health issues. We may often tend to miss them out because we develop, all-inclusive programs, and we don't really become keen in having some components of involving these children with these multi-layered issues. So I would like to commend her presentation, but also to encourage all of us to really look into creating programs that look keenly into children living with these issues. As I recall yesterday, we had a presentation and it was dependent from what they said, that particular presentation. They relied on the children to come to them if they had any sorts of problems that they needed them to talk about. But I'm really thinking about, for example, a child who is living with autism. They face really particular challenges when it comes to language and communication. So for us as professionals, expecting them to really come to you with their problems might not really work in their case, so we might end up missing on helping such a child. Yeah, thank you.
Thank you. I would highly wish to have a remark for the second presenter, because we run the risk of burdening Madam Mweni. For now, the rest you can ask privately. If there is none, then I would wish now to call on Madam Mweni to respond. Okay.
Hello, my name is Maureen Sharon from NeuroKids Warriors. I would like to ask this, especially for kids like the one the professor talked about, the neurodevelopment issues. You find out that if the kid is born, and especially while he's or she's the last born in the house, there's this stigma that normally touches the kids. Like you find like the father is not taking good care of the kid because they normally say like, when unajua malulitoa mtoto mwenye ako na shida. So how do we go about that, the negligence of the kid, ama hiyo mtoto kutengwa na mzazi ambaye ni babake, and yet the baby needs that love from the father and the mother and the whole family. Can you guys teach us on how, or we could, on how we can teach the whole village, or we can teach people on how they should engage with those kids, especially firstborn and lastborn, because most of the cases we find that they're lastborns who are having those cases and lastborn. Thank you.
Okay, thank you. Still for you, Dr. Hari.
Thank you for the questions. In terms of assessment involving that kind of thing at the point of contact, I think even the Children's Act, that's the spirit of involving psychologists. If you look at the Children's Act, at various places it has talked about the court even asking for a psychological report. It's also talking about a psychologist being there when a family conference is being held, even at the point of diversion, you know, at various places. If you look at other jurisdictions, that is almost mandatory. That when a child enters, you know, at the entry stage, which is at the police station, or maybe at probation, they are supposed to be assessed and screened for mental health issues, because that now informs what is going to happen next and the services that the child is supposed to get along the way, so that we can minimize the issue of the justice system being more non-therapeutic than being therapeutic. So, yeah, we can use what is provided for in the Children's Act to also have those. As an association of play therapy, which I belong to, it's an association of people who work with children, mental health professionals who provide services to children. We really advocated for inclusion of mental health services in the Children's Act, and we are glad that some of those things are there. So yes. In terms of documentation, I think here in Kenya, we try as much as possible to ensure that children who pass through the system are documented for. But that does not mean that there is no gap. We have developed something that we call through care procedures for children in statutory institutions, and it says which agency is responsible for documenting what about a child, so that when the child is passed on to a different agency, this one knows what is already known about the child, and it is easier to take it from there. Where I work at probation, every child has a file. You must have a caseload which says you have child A up to child 20, and there's the file, because that's where you put the treatment notes, that's where you put all the details about the child and all the case management issues relating to the child. So documentation is very, very important, including if there's any assessment that has been done, it is put in there. So, yeah. Maybe Uganda can be able to learn some things from Kenya, even as we also learn from the others. There are children officers here. Maybe you can reach out to them. I don't know whether in Uganda the children officers are the ones who are called probation officers, because you're talking about probation officers. I acknowledge the remark about the need to include, to be so deliberate in budgeting for and including mental health service, especially when you're dealing with that child who has no access. Remember, the child in a rehab school, in a hostel, in a Boston institution, in a youth corrective center, has no access to community services. So unless we bring those services to where the child is, they can't be taken every day out there. So yeah, let us remember also those children.
Thank you so much for the clarification. At this point, I want to appreciate all the presenters for the work that they took in and how they have educated us. I also want to take this opportunity to assure you that the final report will have your work and will be shared. I also want to appreciate all of us who stood patiently and the reactions that you did. We don't take it for granted. We are moving on to lunch hour. After this, we'll come for the closing ceremony. Kindly be with us. It would not be good when comes the closing, the hall is empty. So I would call on us to break at this time, end the session. But we may appreciate the two presenters as they walk out of the street. Thank you.